Hello everyone and welcome to another episode of Ask Dr. Bob. Very interesting questions today. I am a 75-year-old female, and for the last several years I seem to get bronchitis, and I want you to know something. I'm glad that you asked this question. Several years ago I had an individual came into my office that was over 60 years old. She was having chronic bronchitis. This is going to be so big. We did a vitamin D test to her. Her vitamin D was 6. I like to see it be 40. All we did, besides telling her to minimize and eliminate sugar, was prescribe a liquid vitamin D, 6,000 units a day, and guess what happened to her chronic bronchitis? It went away. Vitamin D helps absorb or bring the calcium from your intestine to your blood. Vitamin F takes it from your blood to your tissue. I have seen chronic lung problems improve with vitamin D, minimizing sugar, and stay away from citrus. Why is it that women go through menopause, they tend to gain weight, particularly in the abdominal area? It's really a hormonal challenge, because see, menopause itself really should be symptom-free. But if you have adrenal gland exhaustion and or your thyroid gland is subpar, the weight tends to focus around the abdomen area, especially with adrenal exhaustion. So I have so many ladies that come into our practice have no menopause challenges at all. The adrenal gland is the key. If your adrenal gland is exhausted, your menopausal symptoms will be there. You may, in fact, want to take your blood pressure from a sitting to a standing position. If your blood pressure drops, it's a body signal to me you have adrenal fatigue. We talk about this in Dr. Bob's Drugless Guide to Balancing Female Hormones. We have a chapter on weight loss, and that area you talked about is specific for the adrenal glands. Dr. Bob, I've heard you mention that there are foods which eliminate extra estrogen. Can you explain this further? Well, the liver helps process that exogenous or that external from the outside the environment into your body away. So your liver is the key to clear everything. So you want to eat Dr. Bob's ABCs for sure. Apple, beet, and carrot. A half a red apple every day, 1/3 cup of beet fiber, 1 medium carrot. But the main food to minimize estrogen in your body is broccoli. Any green food. I'm kind of smiling because I know that's like, people, can I put cheese in the broccoli? No, steamed broccoli, sauteed broccoli, raw broccoli. Any sulfur vegetable. Broccoli, cabbage, cauliflower. Eggs, onion, and garlic. Okay, the next one. My perfectly healthy 10-year-old son seems to be constantly breaking out with little bumps on his face. What might be the cause? Well, a 10-year-old boy today is probably pre-hormonal. That means his testosterone level is starting to go. So back off on his sugar, back off on his dairy. No dairy. See, they get cow's milk from lactating cows. Progesterone tends to cause acne. I read a great book, Why Not? Don't Drink Your Milk. Don't Drink Your Milk by Dr. Oski. That's where I learned that from. Stay away from dairy. And once again, Dr. Bob's ABCs. A half a red apple, beet fiber, and a medium carrot. I know your 10-year-old might not like that per se, but you might want to even juice it, not more than 8 ounces at a time. Why is it easier for men to lose weight than women? I think a lot has to do with hormones, women's hormones imbalance, but you know what else? Men tend to hold on to and have more lean muscle tissue than their female counterparts. I really believe that has a lot to do with it. And most women tend to have babies, and women who have babies have compromised liver function. If your liver function is not at 100%, harder time to lose weight. Wonderful questions. I would encourage you to watch this over again. These were some really important, excellent questions. Thank you once again for watching Ask Dr. Bob.